Good afternoon, everybody. This is Nurse Eunice with Florida Training Academy, and I can't wait for our Friday Night Live. That is right. We are going to be covering 30 practice questions to help you pass your CNA examination. And as we do in each video, we'll give you about 10 seconds to receive your notifications. And hello, everybody who's in the chat. All right, I'm so excited to see you all. Yes, yes. So I know it's a holiday weekend, so happy Easter, happy Resurrection Day weekend. So let's get started. All right, so question number one, team. Which statement best explains the difference between clean and sterile gloves for a CNA or PCT? A. CNAs must use sterile gloves whenever touching a patient. B. Sterile gloves are used for basic care skills like bathing and feeding. C. CNAs and PCTs use clean gloves for standard care. Sterile gloves are used only by licensed staff for sterile procedures. Or lastly, D. There is no difference between clean and sterile gloves in patient care. And I see so many correct answers coming through, and I see a lot of hellos. So, hello, everybody. All right, revealing the answer in 3, 2, and of course, you got it. I wouldn't expect anything less. Catherine, Miss Bonita, Zanib, Monica, Michelle, Marjorie. All right, so let's explain. So CNAs or PCTs are trained to use clean gloves. Those are the gloves that are on the boxes, inside the boxes in the room during tasks like bathing, toileting, and handling bodily fluids to protect themselves and their patients. Sterile gloves are reserved for procedures that require sterile environment or sterile technique, such as catheter insertion or wound care. We're talking about invasive wound care. And those skills are typically performed by licensed nurses or providers. So everybody, when you are taking your CNA examination for your nursing assistant exam, you cannot perform sterile technique. But once the hospital hires you, they will change your name. You're now called a patient care tech. And in some of those facilities, they will teach you sterile technique because they will teach you how to insert urinary catheters. However, for your test, that is not your level. You cannot perform sterile technique. Therefore, you cannot insert catheters nor do invasive wound care. All right, let's go to question number 2. Which of the following is the correct order for donning, that's putting on, personal protective equipment, PPE? That's right, there's an order to our madness. So is it A, gown, mask, and then gloves? B, mask, gown, gloves? C, gloves, mask, gown? Or D, mask, gloves, and then the gown? And if you don't have pen and paper, I encourage you to get pen and paper, pull it out to take some notes, because when you're in a facility, we have to know how to put on or don our PPE. And then there's a correct order to doff, DOFF, to take off our PPE also. All right, revealing that answer. Oh, I see so many correct answers coming through. Like everybody got it right. It is A. Great job, team. So the sequence ensures maximum protection from contaminants. And so the first thing you'll put on is the gown. The second item would be your mask. If you need eye protection, that would come next, but that wasn't included in this scenario. And then the last thing you put on would be your gloves. And if you need to see that, the CDC, cdc.gov, they have the full lineup of how to put on and take off your PPE. So cdc.gov. Question number 3. When transferring a patient from a bed to the wheelchair, where should the CNA place the wheelchair? Would it be A, at the head of the bed, B, at the foot of the bed, C, parallel to the bed on the patient's stronger side, or D, perpendicular to the bed? When was the last time you used a word like perpendicular? All right, so we have a lot of A's coming through. We have C's coming through. We have a B from Mila. Let's see, team. I'll give you about 5 seconds since we have the full alphabet for this one. All right, so transferring the patient from the bed to the wheelchair. Where should you stand? Is it at the head of the bed, the foot of the bed, parallel to the bed, on the patient's stronger side, or D, perpendicular to the bed? Here's our answer, everybody. Yes, it is C. Great job, team. So parallel to the bed on the patient's stronger side, positioning on the stronger side makes it easier to transfer the resident. So if you stand, if you can also, it didn't say on the weaker side, but that would be an option also. But I know with some patients, if you can help them on the stronger side to get them up, that'll be a little bit easier for the initial part of the transfer. But when in doubt, especially in the real world, if you have a patient with one side of their body that's weaker than the other, don't try to transfer them by yourself. Please get some help in that room. All right, question number 4. A patient is nonverbal and needs to use the bathroom. How should the CNA determine the patient's needs? A, ignore the situation unless the patient calls out. B, wait until the patient signals verbally. C, assume the patient does not need help. Or D, look for nonverbal cues such as pointing or facial expressions. Your patient is nonverbal. And what are some reasons that your patient could be nonverbal? Maybe they had a stroke. Maybe they're intubated. Maybe they were nonverbal or mute from birth. So your patient cannot communicate with you with words. So how are you going to know what their needs are? And that is right, team, because you all chose D. You got it. Yes. So you're going to look for those nonverbal cues such as pointing or facial expressions. The rationale, nonverbal communication helps identify needs when speech is not possible. All right. Good job, team. Question number 5. Which of the following is an example of proper body mechanics? A, twisting at the waist when lifting. B, using the legs to lift heavy objects. C, lifting objects above shoulder height. Or D, keeping feet close together while transferring your patients. And I'm so happy that you all chose to study with me on a Friday night. That's right, Friday Night Live. You're going to be passing your examinations. And looks like Shoshana says B, and Loretta and Chrissy and Mila says B. So everybody, I think the correct response is, drum roll please, B. You got it. Yes. And so we have 2 images here. The first image is how you are not supposed to lift. Do not lift with your back. Lift with your legs. Use those strong leg muscles, and that's going to help you to prevent back injury and strain. Question 6. What is the first action a CNA should take if they discover a fire in a patient's room? A, extinguish the fire. B, sound the fire alarm. C, call the fire department. Or D, rescue the patient from immediate danger. All right, so there's a fire in your patient's room. What do you do first? And I know you know these acronyms because we talk about them a lot in our videos. So what do you do if there is a fire, everybody? That is right, team. You race. So the correct response is going to be, Shelda says D, and she is right. So we're going to first rescue the patient that's in immediate danger. And then you're going to follow the rest of the RACE protocol. And so RACE stands for rescue. After you get your patients out of harm's way, that's when you can pull the fire alarm, or if you're in a home care setting, you can call 911. You're either pulling the alarm or you're alerting somebody. C would be to confine. A lot of your doors in your hospitals, they have a fire rating, which means it may take an hour before the fire can actually go through that door. So you want to confine the fire, kind of close it off. And then E, you either exit that building if you cannot do the other E, which is extinguish the fire with the fire extinguisher. So that is the acronym that you would follow if there's a fire emergency in your facility. Question 7. How often should a bedridden patient be repositioned? Oh, this is so easy. Is it once per shift, every 2 hours, every 4 hours, or only when requested? And I know you're some great caregivers, and you're not just going to let your patients lay in one place all day. So what do you think the best response is, team? And you got it right, and you got it right, and everybody got it right. The correct response is every 2 hours. Okay, and so that's textbook. Every 2 hours is textbook. The other option is and more frequently if the patient requests it or needs it. Some people can't lay in one place for 2 hours. I know I can't sit down for 2 hours without being uncomfortable. So if you go in, your patients, maybe, hey, take this pillow out. I know you put me on my side and it's approaching the 2 hour mark, you may want to consider doing it a little bit more frequently because you can't sit for 2 hours. So imagine your patient being stuck on one side or on their back for 2 hours without you coming in and alleviating or turning them again. Question number 8. What is the proper way to measure a patient's urinary output? Hold up, I got a Shamoya. Hello, Shamoya. Shamoya, good evening. I hope you remember me. I traveled from the Keys to Jacksonville for your class, and I passed my exam on the questions. I only got 3 wrong. Shamoya, I'm so proud of you. Of course, I remember you. Congratulations. You worked hard. I can't wait to tell Miss Loretta about you. So, yay! So proud of you, girl. All right, everybody. My heart is over here smiling. All right, so question number 8. What is the proper way to measure a patient's urinary output? A, estimate the amount visually. B, ask the resident how many times they urinated on your shift. C, pour the urine into a measuring container and read at eye level. Or D, weigh the patient before and after voiding. And looks like everybody got it right. But one thing I remember about Shamoy is that she also purchased our online CNA exam prep course. And then she asked questions. She came in person and do hands-on. So she really invested the time and passed that test on her first attempt. So proud of you, girl. All right. Yes, everybody. The answer is C. Especially when you take your test, you may have to perform a skill that requires you to empty a urinary drainage bag and measure the contents. You're going to put a napkin on the counter in the bathroom. You would then place your graduated container with the urine in it on top of that napkin, and you would bend down to read the urine amount at eye level. So you cannot hold it up in order to read it, because if the fluid is moving, you will not get an accurate reading. All right, question number 9. What is the best way to communicate with a hearing impaired patient? A, use written notes or gestures. B, ignore the impairment and speak normally. C, speak loudly and quickly. D, turn away from the patient while speaking. Well, D is rude. And you don't want to do C. Why are you screaming at somebody who's hard of hearing? So that is right, Vanessa and Risha and Love and Loretta and Kiasha. It is A. The best way to communicate is to use clear, visual, clear written notes or gestures. And then you also want to be looking directly at the patient, and you don't want to use exaggerated facial expressions. You want to speak normally at your normal tone, but allow them to read your lips. All right, so question number 10, friends. Question number 10, which of the following best prevents the spread of infection in healthcare settings? Is it wearing gloves all the time, frequent hand washing, frequent use of hand sanitizer, or D, using alcohol-based hand sanitizer only? You got 15 patients. You are ripping and running. How do you prevent the spread of infection from patient 1 to patient 2, all the way down to patient 15? And that is right, you have to wash those grubby little hands. It is not about using hand sanitizer. Hand sanitizer does not kill everything. It does not kill C. diff. So if you wash your hands out, however, it will, the friction will remove the germs off of your hand. The soap will kill whatever germs it can, but then the running water will wash the germs down the drain. So hand washing is always going to be the number one choice. And especially when you take your CNA examination, hand sanitizer is not an option. So when you do your intro, when you knock, hello, my name is Eunice. I'm your CNA today, and I'm here to take your pulse. You will not have hand sanitizer. After you do your greeting and you get that resident's permission, you have to go and wash your hands for at least 20 seconds. Question 11. Which type of precaution is required for a resident with MRSA? Is it droplet, airborne, standard, or contact? And for you all who don't know what MRSA stands for, that is methicillin resistant Staphylococcus aureus. So, anyway, it is an infection that is hard to kill with antibiotics. And so, if this patient has a bug that common antibiotics can't kill, and that gets in a wound, it can get in their sputum, it can get in their blood. What do you think you should be wearing for PPE? Oh, Lord. Who is this person talking about most nurses are devils in human form? Stevie, we're putting you in timeout. All right. Ignore Stevie because you all are the future. And I don't know what nurses he's encountered, but I've encountered great nurses, just like I've encountered great CNAs. And you all are going to be those CNAs becoming great nurses. So Stevie's in timeout. Bye, Stevie. All right. So question number 11. If you chose D, you were absolutely correct. So MRSA is not spread necessarily via the air unless this person is coughing and aerosolizing and they have in their sputum. So usually you're just going to need contact precautions. So you're going to have on your gown and also your gloves. So the correct response is D. Question 12. You are caring for a debilitated patient who screams loudly each time you attempt to turn them in bed. What is the best action for you to take next? A, stop turning the patient and wait until the next scheduled repositioning time. B, leave the room and come back later when the patient is calmer. C, immediately apply restraint to prevent the patient from moving. Or D, gently explain what you are doing and continue to reposition slowly while observing their reactions. So Anne, at the very top, I pinned a comment that's going to ask you to go to nurseeunice.com or fltraining.com. If you go to nurseeunice.com, kind of scroll down to the bottom, we should have free practice tests there for you. But then also, if you go to our website, fltraining.com, and go to resources, and then from there, you should see like Prometric and NNAAP practice test. But I need you to practice a whole bunch of test questions and just not try to memorize the answer. You have to understand medical terminology. So we also have videos on medical terminology. And I wish you much success on your test on Monday, girl. All right, I know you can do it. You can and you will pass the CNA exam. All right, so let me hide that comment and let's see what the correct response is for number 12. That's right, Miss Bonita and Elaine. You all have the correct response. You're going to gently explain what you are doing and continue to reposition slowly while observing their reactions. This patient isn't fighting. They sometimes anticipate pain, maybe because the last caregiver was rough. Now, if this patient just continues to scream out, you can, of course, stop it, go let your nurse be made aware, because maybe your nurse needs to pre-medicate this patient, even if it's just something with like Tylenol, because when they are laying in one position for a long time, they can actually have, some pain, and plus on top of that, they can have some mental issues too. So you want to let your nurse know if you cannot get it accomplished. But for this particular question, the best response was D. Question 13. What is the primary purpose of range of motion exercises? Is it A, build muscle, B, increase pain tolerance, C, improve joint flexibility, or D, avoid physical therapy? When you have your patients reaching for stuff, let me tell you about range of motion. From the time that you walk in the room as a CNA, if that patient can help you at all, you want to encourage them to help you. Just don't let them sit in the bed all day and do nothing. So it's like, hey, Miss Eunice, can you go ahead and comb your hair? Even if one side of their body is weak. On the side they can move, you want them to participate in their care to kind of feed themselves. So what is the purpose of range of motion exercises? And if you said C, you got it right. So yes, range of motion improves joint flexibility, mobility, and prevents stiffness. It does not improve muscle mass. So them lifting weights or them doing a weight bearing exercise would build muscle. Range of motion allows the joints to remain flexible. Question 14. Which oral care tool is most appropriate for a CNA to use when providing oral care to an unconscious patient? Is it A, regular toothbrush and toothpaste, B, electric toothbrush, C, lemon glycerin swabs, or D, foam tip swabs and a padded tongue blade? Excuse me. And so, Miss Sims, my goal this weekend is to finish my new CNA book. It has just been a really busy year. And so, hopefully, that book is going to be completed this weekend. But if not, whichever book that your school has recommended would be the book that I recommend. Once my book is created, my new book is going to have practice questions. It's, of course, going to have a lot of content, but it's also going to have the clinical skills too. So, but for right now, go with whatever book your school has recommended you to use. All right, so let's go ahead and go to our answer, everybody. Our answer for question 14 is D. We're going to use foam tipped swabs. If you have a padded tongue blade, that is wonderful. That can kind of like keep their mouth open. You never want to stick your finger inside of a patient's mouth, even if they are unconscious, because just reflexes, they can bite down. And so as we talked about in one of our previous videos, whenever you are cleaning the mouth of an unconscious patient, it's best to have them on their side because they may not have a gag reflex. So if you have them sitting upright doing the oral care, that fluid can accumulate and go down to the back of their throat. And because they're unconscious without a gag reflex, they can aspirate. But if you turn them to their side, that fluid will accumulate in the cheek area. And some of those foam tip swabs actually can be connected to suction. So you can dip it in mouthwash, you can clean their mouth, and then when you're done, you activate the suction and you can suck the secretions right back out. It just depends on where you work at and what equipment is available in your facility. All right, question 15. What should you do if a resident refuses physical therapy? A, document the refusal and notify the nurse. B, force them to go. C, reschedule it yourself. Or D, ignore the refusal. So Miss Nancy does not want to go to physical therapy. She is tired of going down there and being told what to do. What are you going to do as the tech that day? And that's right, the path of least resistance. You can ask her why. You can try to remind her of the benefits of physical therapy, but you're going to do A. You're going to document, hey, she refused. And it usually goes the opposite way. You communicate first with the nurse. And then when you document, you want to document that the nurse was made aware. So communicate with the nurse first, because the nurse could actually get the patient in there and maybe persuade the patient to go to physical therapy. So communication first, documentation second. Question 16. Hey, don't forget, you all, to like, share, and subscribe. We are so close to 1 million viewers. 1 million subscribers. We get 1 million viewers. We need 1 million subscribers, you all, just because I want to be one of the first nurses in Jacksonville that I know of who has a gold play button. I know it's vanity, but we work hard. We want our recognition. So if you haven't subscribed and you've been here already for 15 questions, go ahead and make it official. Help a nurse out. All right, everybody. Question number 16. All right, and it looks like we have another question here. Sorry, so everybody pause just for a moment. Becky asks, I'm planning to register for a BLS course in the next few weeks. Any tips? Girl, we have a full CPR playlist too. Like literally people use my videos to teach their CPR classes. So when you get through with this video, you want to go to our playlist, which is on YouTube, is Florida Training, and then look for CPR videos. We have a video with I think like 600,000 views, and that's going to be the one that I recommend, and you will pass your BLS course. All right, so our next question, everybody. A resident with aphasia is admitted to your unit. What should the CNA anticipate? A, that the resident is unable to speak. B, the resident cannot eat or swallow. C, the resident is incontinent of urine. Or D, the resident has impaired vision. So this is requiring you to understand medical terminology. We have videos on this too. So the A in front of a word, the prefix usually means the lack of. What does phagia mean? We have A's, we have B's. Ooh, it's so close. Ooh, I'm going to wait for 5 more responses. We got one. We got two. We need three more responses. We have all the responses, everybody. So revealing the answer in three, two, and aphasia means the inability to eat or swallow. So aphasia, they look the same, but one has a G and one has a S. Aphasia is the medical term for an inability to speak. So that's why when you're like learning these, when you're watching these practice question videos, please have pen and paper with you, because we're going to be giving you pointers that's going to help you on your written test, because you have to know medical terminology. So back to aphasia. Aphasia means the inability to swallow or rest. This condition may require alternative feeding methods like tube feeding. Understanding this term helps CNAs anticipate NPO statuses. And so you all should know what NPO stands for. It is nothing but mouth. If a person has aphasia, they're also going to be placed on aspiration precautions, and possibly they could have an order for thickened liquids because they are at a higher risk of aspiration. Question 17. What is the proper way? I know, Shoshana, that one was tricky. I did it. I made you all think a little bit more. All right, so what's the proper way to handle soiled linens? A, place them on the floor. B, shake them out to remove debris. C, hold them away from your uniform. Or D, set them on the resident's bed. Now, I know what you do in the real world, but don't do that when you take your test, and don't do it when you answer these questions. So what is the least contaminating way to handle soiled linens? And that is right, Maria, Mariana, soul sister, Jennifer. So when you take your test, you all, and you are handling the linens, if a linen accidentally touches your uniform, I need you to say correction. The nurse saw it. The evaluator saw it. So you need to let her know that, hey, I saw it too. I made a mistake. You want to go ahead and verbalize it so that they know that that wasn't intentional and that you would not make that mistake in the real world. All right. And so there are so many comments going through. So if I did miss a statement or a question that you had, just go ahead and retype it towards the end of the video. All right. Question number 17. I'm sorry, the answer to 17 was C. You're going to hold those linens away, and that's going to help you to prevent from contaminating your uniform. Question number 18. A resident with diabetes suddenly appears confused and shaky. What is the best first action? A, offer the resident orange juice if allowed by the care plan. B, call the nurse and wait for instructions. C, check their blood pressure. D, assist them to their room and let them rest. Yeah, this one's tricky too. She has diabetes. She's confused and shaky. You're the CNA. You're the tech. What do you do? I see so many correct answers. No one stepped outside their scope of practice. And so anybody who's saying check their blood pressure, the person has diabetes. So if they are suddenly confused and shaky, that is a sign that their blood sugar levels are abnormal, usually that their sugars are low. And so this one wants to know if you as a CNA or a tech know what to do if a patient has an episode of hypoglycemia. And the correct response is going to be B, do not act without the nurse. You can't anticipate my order. My order came from the doctor. And if this patient's unable to swallow because their blood sugar is so low, I may have to start an IV and give them intravenous dextrose. So, yes, the shakiness and confusion was a sign of hypoglycemia. Hypo prefix, low. Glycemia refers to the level of sugar within the blood, so the blood sugar. If you notice this, you're going to notify the nurse. Usually the nurse will tell you to get the glucometer to do the finger stick so that we can get a bedside sample to figure out what their blood sugars are. And then based off of that reading and the patient's presentation, your nurse will tell you if juice is needed. Because if the patient is unresponsive, we're not giving them juice. We're giving them something in their IV instead. All right, so question 19. You are assisting a patient diagnosed with orthopnea. Which of the following positions would best support this condition? New word. Would it be A, supine with legs elevated? B, side lying with knees flexed? C, sitting upright or in a Fowler's position? D, prone with head turned to one side? And so, if you don't understand those medical terms, I need you to start writing some of this stuff down because this is how we speak. It's like, hey, put them in a supine position, put them prone, put them in Fowlers. So, these are the medical terms you're going to hear day one on your job. So, you need to go ahead and understand them now. And orthopnea refers to difficulty breathing as it relates to positioning. So if your patient's having a hard time breathing, we're going to do C. That's right, team. We're going to sit them upright. The fluids are still in their lungs, but when you sit them upright, they go to the base of the lungs. So orthopnea is difficulty breathing while lying flat. So your patients with congestive heart failure, with pneumonia, they're going to have orthopnea. It's relieved by sitting upright or using pillows to elevate the upper body. Understanding this term is critical for CNAs who assist with positioning and respiratory comfort. Question number 20, you all, you're doing so well. And if you haven't liked this video, hearted this video, shared this video, come on now, help me out. It's Friday night and we're here and we're studying. So question number 20. The nurse states that a patient has diaphoresis. What observation would confirm this? Is it A, excessive sweating, B, dry, flaky skin, C, blood in the urine, or D, yellowing of the eyes? What does diaphoresis mean? We're torn between A's and B's, but we have way more A's than we do B's. So all of my A's say A because you have it correct. It is excessive sweating. So diaphoresis, or another term you may hear is diaphoretic, refers to excessive sweating, often due to fever, pain, or medical conditions such as hypoglycemia or shock. Recognizing and reporting this symptom helps in early intervention. This is what I have no idea what that person's talking about. Okay, question 21, you all. I need to have some of y'all as moderators so that you can put some people in timeout if necessary. All right, so question 21. When assisting a resident with hemiplegia, paralysis on one side, so this is different for weakness. They have paralysis on one side. What side should you support during the transfer? Is it A, always the left side, B, the side with paralysis, C, the strongest side, or D, let the resident choose? I love you also, Sam. Let's show that comment. I love you too. Yeah, you all are going to have some really hard days when you work as a tech. On your way to becoming a CNA, a doctor, whatever your goal is. And so if you can work with some positive, bubbly people who know how to work, it won't feel as bad. But if you're around some miserable, complaining people, it doesn't matter if you have one patient, it's just going to make the day longer. So I need you, the same energy that I have, I need you to show that energy when you're dealing with your patients, but also when you're interacting with your coworkers. So that is right. You all, the answer is B. Always support the weaker side. So if somebody is paralyzed on one side, it's not moving. So they can get their cane with one side of their body. You're going to have to move the other side for them. And so hemiplegia is usually common after a stroke. So you're going to support the weaker side to prevent the fall and provide effective assistance. Question 22. You are asked to monitor a resident with ecchymosis. Where should you look for changes? So this wants to make sure that you understand what ecchymosis means. Would it be A, in the resident's stool, B, on the resident's tongue for swelling, C, in the resident's urine output, or D, on the resident's skin for bruising? Look it up. Look it up. What does ecchymosis mean? Revealing the answer in 10, 9, 8, because I only saw 2 correct answers so far. 7, 6, 5, 4, 3, 2. I see some correct responses coming through. So for all you all who put D, you got it. That's right. Ecchymosis is a medical term for bruising. It could be large purple or blue discoloration caused by bleeding under the skin. It can be a sign of trauma or clotting issues and must be documented. So you're going to see it. You're going to walk into a patient's room and see all these different blotches on their skin, and you can tell that was probably done by the phlebotomist, not because the phlebotomist had a bad technique, but because this person had a condition that caused them to bleed more easier. Who would have a condition that causes them to bleed more easier. A patient who's had a stroke, especially if the stroke was caused by a blockage, because after which they're going to be on blood thinners for life. And because they're on blood thinners, they're going to have the ecchymosis. All right, our next question, question 23, team, and we're going all the way to question number 30. The charge nurse tells you a resident has contractures. As a CNA, what should you focus on during care? A, preventing early labor by keeping the patient on bed rest. B, using range of motion exercises to maintain flexibility. C, monitoring fluid intake to prevent dehydration. Or D, performing oral suctioning every 2 hours. This patient has contractures. What do you do as a CNA? Oh, you all are so dang on smart. I didn't trick anybody. So you all know that contractures and contractions are different. So if you're on the labor and mother and baby unit and your patient's having contractions, that's when you would do A. You would keep them on bed rest. But you all are so awesome. You all knew that the correct response was B. So a contracture occurs from lack of range of motion. If you don't move it, you lose it. So contractions are permanent tightening of muscles, tendons, or ligaments, often due to immobility. So how do we prevent this? Range of motion and proper positioning. So in some of your nursing homes, you are going to have 30 patients. If it's a bad night, the other tech didn't come through, you leave a patient in a position for too long. And when you do try to get them out of the position, they're going to be like, hey, leave me alone, or ouch, that hurts. And so when they say, ouch, it hurts, you know what we do? We leave it alone. And we leave it alone, and we leave it alone. And eventually they return to a fetal position. So if your patient is having pain with movement, try to put a pillow maybe under their arm, reposition. If their hands are curling in, you can start putting a washcloth, a rolled washcloth in their hand, and eventually it's going to start opening. And hopefully that will give that nurse time enough to call the doctor, to get the physical therapist in so we can get them some braces, some type of hand brace. But you as a CNA are going to be the first one who notices these contractures. So please make your nurse be made aware. That's right, Marisol. Ding, 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 ding. I appreciate you, girl. Don't forget to hit the like button. All right. So, our next question, everybody. Question 24. Which statement reflects proper documentation by a CNA or PCT? A, Mr. Lee was rude and uncooperative today. C, resident seems mad and faking pain again. C, resident stated I have pain in my lower back and grimaced when moved. D, resident did something strange at 10 a.m. That's right, Anne and Lois. You have it correct. The correct response is going to be C. And so, whenever you're documenting, you want to use objective documentation. So, you pretty much want to say exactly what the patient says. So, documentation should be objective and include direct quotes, observations, and facts. For example, if you find a patient on the floor, you do not document that the patient fell. Because if you saw the patient falling, you should have stopped the fall. What you need to document is patient found on the floor, what time they were found on the floor, who you called in the room, etc. And so your facility should teach you how to document, not just to keep yourself out of trouble, but to try to keep that facility out of trouble too. So you document exactly what you observed, not what you think might have happened. Question 25, team. What is the safest method for identifying a resident before providing care? All right, so is it A, check the resident's wristband and verify with care plan? B, use the name posted on the door? C, ask their roommate? Or D, ask the resident if they are Mr. Johnson? And so I want you to think long-term care. I want you to think assisted living facility. I want you to think of a place outside of a hospital. You still have to verify identity in a hospital, but usually the hospital has those scanners, those electronic devices. So you may not know this patient. What's the safest method of identifying them before you provide care? And everybody has a correct response. It is A. So what is the care plan for? Because sometimes, even though you think you have the right patient, let's say there's an order for a patient to be NPO and you go in and you take this patient's tray. Your care plan, your order set will let you know if that is accurate. So you do want to be referring to those orders even as a CNA and question some things. Nurse Eunice, why is Mr. Johnson's NPO? And I'd be like, girl, he's not NPO. I need to go check that order real quick because maybe the doctor just added something. So again, we communicate to make sure our patients stay safe and to make sure they get the care that they need based upon their care plan. Question 26. When cleaning a resident's room, you find medications in their drawer. What should you do? A, throw them away. B, give the resident their medication. C, leave them where they are. D, report it to the nurse immediately. It could just be some Tylenol, or it could be their collection of illegal drugs. You know, patients, they're human. So you find some medicines, what do? That is right, Mona and Darlene. Go tell your nurse. All right. We don't know what those pills are. We're not there to try to figure it out. So CNAs, you don't handle medications. You're going to report those findings to the nurse immediately for safety. And then the nurse will confiscate those medications, call the doctor, etc. Because sometimes patients will divert medications. The nurse is supposed to watch the patient swallow the pills. Some nurses are just too busy. They don't. They give them a couple of pills, especially in your nursing home, leave them at the bedside. And some patients do resell medications, or they're going to take the medications later, or they don't take them at all. So once you become a nurse, CNAs, make sure that you actually watch your patients take their pills and have them say afterwards to make sure that the pills actually went down. All right, question 27. A client has a history of syncope. What should the CNA be most cautious about? A, the client is the client is at risk of becoming violent. B, the client may faint unexpectedly. C, the client could have allergic reactions. Or D, the client is at risk of seizures. So if a client has syncope, what are they at risk for? Oh, we are torn between B's and D's. Ooh, it was close at first. It's still close. So everybody, I need you to get pen and paper. This is another term that you need. So we have aphasia, we have aphasia, we have ecchymosis, we have syncope. So these are some new terms today. So syncope is passing out, y'all. It is B. So great job for those who chose B. A syncopal episode or syncope is the medical term for fainting or temporary loss of consciousness, often due to low blood pressure or sudden position changes. So safety precautions include slow position changes when you get your patient out of bed. So we have a patient right here. If we're getting him out of the bed for the first time, we allow him to sit at the edge of the bed for a few minutes while you still have your hand on him. Okay, Mr. Lucas, just go ahead and let's sit on the edge of the bed for a few minutes. How do you feel? And then slow position changes. So after they sit on the edge of the bed for maybe 1 or 2 minutes, that's when you can stand them up. And then you ask them again, how do you feel? Are you dizzy? And that's going to decrease their chances of having a syncopal episode. That's right, Kelly. New word. All right, question 2018. A resident becomes combative during a bath. Leave me alone. What should you do first? A, yell for help and restrain the resident. B, continue bathing them quickly to get it done. C, leave the room and tell the nurse later. D, step back, ensure safety, and speak calmly. Thank you, Yannick. All right, they're combative during a bath. It doesn't mean that they're in the shower. You could be bathing them while they're in bed, but now they're trying to hit you. So what do? That is right. You protect yourself. So the answer is going to be D. A calm and respectful approach prioritizes safety and may de-escalate the situation. The patient told you they didn't want a bath. You was trying to give it to them anyway, so they tried to hit you. All right. Sometimes we just have to, again, the path of least resistance. Some things are above your pay grade, CNAs. When they don't allow you to do something, as long as they're safe, go get that nurse and tell that nurse what's happening. And then don't forget to document. Question 29. A resident complains of paresthesia in both feet. Which statement by the resident best supports this condition? All right, so is it A, I keep losing my balance? B, my legs feel stiff when I walk? C, it feels like pins and needle in my feet? Or D, there's a rash between my toes? So what does paresthesia mean? Revealing the correct response in 10 seconds, you all. I know how to word my questions now. I'm going to be introducing new medical terminology because you all, we have hundreds of CNA videos. And so a lot of you all, thank you for being so faithful and watching our videos in our channel. But I got to switch my questions up a little bit more. Otherwise, you all know the answer to every question. All right, so revealing the correct response in 5, 4, 3, 2, and we were all around the alphabet on this one, but paresthesia stands for tingling and numbness. So it is C. So we usually call it like neuropathy. That's another term you'll hear. But paresthesia refers to tingling, prickling, or numbness, often described as pins and needles. It can result from poor circulation, nerve damage, or pressure on nerves. So who else will have paresthesia? Maybe somebody who has an issue with their sciatic nerve. All right, so great job, team. I can't believe we're on question 30. I'm going to miss y'all. It's almost over. Question 30. The nurse explains that a resident has bradykinesia. Which activity would likely be challenging for this resident? A, sitting upright, B, quickly walking to the dining hall, C, swallowing liquids, or D, remaining calm during care. And if you've watched our videos, you know this medical terminology. So what does Brady stand for and what does kinesia stand for? And then you smush it together and you come up with your medical term. Let's see. I see D's. I see a C. I see a A. I see some more D's. I see a B. I see a lot more B's. And so, oh, you all are everywhere. Brady, you all. Think of bradycardia. So what does the prefix Brady stand for? Put it in the chat. Let's break these terms down. The nurse explains that a resident has something related to Brady. Bradycardia means what? That's right, Naomi and Catherine. Let me see here. Make sure I get one. So Brady means slow. So if that's all you know about this medical term is that the first word is Brady. The patient has an issue with being slow about something. So with that thought in mind, anybody who gave me an answer other than B, give me B as the answer. So bradykinesia, it refers to the slowness of movement. So kinesia, kinesthetics, that's moving, Brady being slow. So this is commonly associated with those who have Parkinson's disease. They have like that shuffling walk where their feet don't pick up, they don't lift off the ground, they shuffle like a mummy. So bradykinesia, slowness of movement, commonly associated with Parkinson's disease. Tasks requiring quick or repetitive movement can become difficult. So CNA should allow extra time because the patient is slow and use fall precautions. So everybody, guess what? Y'all know that caring CNAs become caring nurses, and I don't care what the last nurse did or what the last CNA did. I'm training you better so that you do better. And so you all are awesome. You are wonderful. You are blessed. And you all, amazing job, team. Give yourself applause. So you all, next week I have a pediatric advanced life support class with a local college. And then we have our NCLEX skills lab, I think on Wednesday and Thursday. And then on Saturday, I have the IV therapy course for nurses. So I may be on Tuesday. Don't hold me on it. But of course, we have a new nurse, Jackie. So Jackie should be on Monday with another practice test. And I may have to have her do the phlebotomy exam. But I will try to get back on Tuesday. And you all know I love you and appreciate you. So thank you all. Have a wonderful holiday weekend. And I'll see you in the next video. If somebody has questions, I'll stay around for about 2 minutes and I will be in the comment area answering those questions. So bye, everybody. Good night. Love you.